Hi everybody, your friendly neighborhood registered vet tech and cat and dog behavior consultant here again to share some practical applications and videos of cooperative care, fear-free and low-stress handling with dogs. So if you haven't heard of fear-free, low-stress handling or cooperative care, these are just handling techniques that result in less stress for animals, humans, everybody. And I wanted to share my love of these techniques, which is why I created this video, just so you can see some practical applications. So again, this is just a brief overview to introduce you to the possibilities of what these techniques can result in. So I hope you guys enjoy, and be sure to check out my cat video where I go even more in detail about what fear-free and cooperative care is. This is a video of my dog Ness from a few years ago, actually. She had an exam and vaccines that were due. Ness has generalized anxiety, and we've worked together to help her overall be less stressed with everything, including veterinary visits. To help set her up for success, I brought her dog bed from home. I had her wear an Adaptil-infused Thunder shirt. We had everything we needed to set up in the room ahead of time, vaccines, blood tubes, etc. Classical music was playing in the room to help drown out the sound of stressful stimuli in the hospital. And we called the vet when we arrived so we would have a clear path directly to the exam room. So we just hung out comfortably in the car where Ness is happy and relaxed. And when an exam room was open, we went right in to avoid the lobby, Ness seeing other dogs and other things that may cause her arousal or stress. So this is after her exam. We gave her a little break, which that break was only 5 to 10 seconds because she chose to come back and solicit attention from the vet, which was huge. I used treats to lure her into place instead of physically manipulate her. I cue a down behavior because, again, instead of physically manipulating the patient, I always ask if the patient can perform a learned behavior. And in many cases in the vet visit, there's a lot of stressors, so it's a different kind of environment. So they may not be able to perform that learned behavior they can at home or a more relaxed environment. And then if no response to that, I just move to luring or like using a toy or food to get them in the position I'd like them. The doctor uses Considerate Approach and doesn't loom over her, starts to touch her. She's going to touch the area that the vaccine is going to be administered in prior to Ness getting the vaccine. So we can assess if there's any changes in her body language, because if she has pain there, just some subtle touch could be related. We would maybe see signs of pain. But if we just gave the vaccine right away, people would definitely assume, oh, it was the vaccine. Also, just reaching out for a dog, giving them a vaccine and removing yourself, that's a startled incident. So when we slowly accustom our touch to them, give the vaccine and then touch some more, and then after the vaccine, she chooses to hang out, and then she walks away for a second and comes right back to the vet for more love. This is a video of my dog Ness getting her blood drawn at a recent wellness exam. The video isn't great because this is real life, and I was actually planning on drawing her blood from her jugular vein, which is in her neck, because that's the preferred blood draw area she tends to like. And we've worked a lot on that at home, but this is where it's important to work with the individual animal in front of you, because we noticed when I cued Ness to go in between my legs, she paused for a few seconds. And then when I got her in between my legs, she was averting her gaze, which is a subtle sign of anxiety. So we're like, let's not do this. Let's change it up based on what she's showing us. And we chose to draw from a lateral saphenous instead. You can't really see, but she has a licky mat where she's eating, and Rachel is communicating with me the whole time what she's doing. So you can kind of hear her munching. Rachel's communicating that she is palpating the vein, what she's doing. She let me know that she's in. I have a hold of Ness. She's enjoying her licky mat. And then I communicate that I'm going to hold off for her. And that blood draw took 15 seconds, and Ness continued to eat off her licky mat. But if we would have kept trying to draw from the jugular, that would have taken a lot longer. So proof, of course, that we know when it comes to low stress handling, fear-free, cooperative care, once these skills are known, it actually helps to make medical procedures a lot shorter and more enjoyable, again, for everybody. I wanted to share a few videos of me and Ness working on cooperative care behaviors. Remember, cooperative care is where the animal either gives consent by performing a behavior or is easily distracted with minimal to no stress in their body language by food during a veterinary procedure. Consent, of course, is giving permission for something to happen. So in animal training, it's a behavior that has been taught to allow the trainer or caregiver to touch or perform a procedure on the animal. In this first video, I'm teaching Ness a cooperative care behavior, which for her, she prefers laying on her side. And that is the consent behavior that she was most comfortable with. So that's what we worked on. And in this first video, you're going to see us working and practicing that, which of course we've practiced daily for a few minutes every day. And then in the following videos, you're going to see practical applications of Ness receiving an injection and getting a nail trim, but with us utilizing these awesome cooperative care behaviors. Predictor cues are what they sound like. You say the word and then that thing happens. When things are predictable for all living species, you feel safer. So we've practiced pairing hand with me touching with a treat. And as you can see, the pinch and the poke, those are things that we've practiced a lot. So now I'm utilizing those predictor cues along with the consent behavior of her laying down with her head down. So I added the syringe in front of her, which can change up the environment a lot. That's a big thing. And if her body language changed or she chose to get up, then I would lower my criteria and we would start without the syringe and the pitcher. Because it's all about the dog being comfortable. If the dog is exhibiting signs of stress, which in this case, it could be her head going up, just like I saw here. So she lifted her head a small amount. So I actually tossed the treat to reset her to see if she chooses to come back, because cooperative care is all about choice and respecting that choice. We want to reinforce your dog for saying no. That's awesome. But also, of course, reinforce them for saying yes. A touch gradient is all about starting at a less sensitive area. So most dogs are fans of their neck and shoulder, but maybe when you get to their rear end, they might be a little more uncomfortable. So I would start at the shoulders and go down to the back, for example. The rear end, I mean. So here are examples of us utilizing that consent behavior that we've worked on together and those predictor cues to give Ness an injection as well as a nail trim. Ness has arthritis, so she receives an injection called Adequan, along with a multimodal pain management plan, which includes rehab, laser therapy, and medications. So you see she's laying laterally with her head on the ground. I'm using my predictor cues. She's receiving the injection now subcutaneously, which means under her skin. She's like, Mom, what are you talking about? And then this is another example of another Adequan injection, because these are things that she currently receives twice a week. And then that will most likely decrease over time. But right now, it's a medication that's more recently started. So again, I'm utilizing those predictor cues. She's laying laterally with her head down. Here's another example of me utilizing the consent behavior. Her face is just adorable. Those big brown eyes. And the predictor cues for a nail trim. So I say hands. I start at her hip instead of grabbing her foot, of course, because that's that touch gradient. And then I say cut when I cut the nails. So cooperative care is awesome. These are just a few ways that me and Ness utilize these behaviors. And again, consent behaviors can be lots of different things. But for Ness, it was laying laterally because that's what she preferred. And it's all about working with the dog in front of you. And again, it makes nail trims, these injections that I had to start giving weekly, so much less stressful for, of course, her, but also me.